Welcome to Nevada Newsmakers. On the broadcast today, we have the CEO of University Medical Center, Mason Van Houweling, for the whole show on an all-new Nevada Newsmakers.
All systems check. All right, Sam, let's go check out some D&D roof.
Hey, Ken. From up here, you can really tell the difference a quality D&D roof makes.
You're right, Sam. With our experience, knowledge, and staff, nothing compares to a D&D roof. Hey,
look down there. It's our D&D roofing crew.
I'll bank the plane so we can get a closer look. Sam! You watch your company's bottom line, and I'll cover the top of it.
Nearly 200,000 Nevadans work in retail businesses, supporting families and the community. Nevada's retail businesses generated over $2 billion in sales tax revenue in 1 year, including nearly $700 million to help our schools. Shop around and see all that Nevada's retailers offer our state.
We're the Retail Association of Nevada, representing thousands of Nevada businesses.
Businesses that work for Nevada.
Take a look at Pro Group Management and see how your workers' comp requirements can be met head-on. By taking a proactive approach, Pro Group can assure that your company is meeting or exceeding state and federal standards. As you move forward in your industry, Pro Group moves with you, simplifying regulatory tasks, clearing the way so you can get the job done and look to your future success. Pro Group Management, workers' comp that works for you.
Early in the morning or throughout the night, professional truck drivers are on the job, serving you, safely moving freight that's crucial to our economy. From the oldest industries to our newest innovators, from the exotic to the everyday, trucks are everywhere, moving everything. Never afraid to embrace a future that makes Nevada and our nation stronger. Trucking moves America forward.
Hi, I'm Eric Robnett, owner of Home Energy Experts. Has this ever happened to you?
Honey, did you remember to turn down the thermostat?
Forgetting to set the temperature? Not fun. We can help. Our new smart thermostat keeps the temperature set for your comfort all by itself.
I'm feeling hot now.
To increase your comfort, go to homeenergyexperts.com for details. That's homeenergyexperts.com.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, coming to you from the old Supreme Court in the state capitol in Carson City. And we're pleased to welcome for the first time to the program, Mason Van Houweling. He's the CEO of University Medical Center. A pleasure to have you on the program, sir.
Thank you, Sam. I'm glad to be here this morning.
For those in Northern Nevada that may not be familiar, University Medical Center is Nevada's only level 1 trauma center. It's the only burn center in the state. It's also the only transplant center, the only designated pediatric trauma center, and Nevada's most sophisticated diagnostic and surgical technology center. You know, it's been an interesting time, obviously, with the shootings in Las Vegas. Obviously, what a terrible tragedy. But it was interesting in conversations with people at University Medical Center that this was something that you had all trained for. This was not something that was just everybody arrived and it was a panic.
That's correct. And UMC has been serving the community for a long time. In fact, since 1931, when we started out with 1 doctor and 1 nurse taking care of the workers of the Boulder Dam at the time, and now has become the most sophisticated, highest level of care in the entire state of Nevada. And I was there that evening, and while the very worst tragedy happened in our community, in our city, I saw the very best come out of UMC and the staff and our entire community. So I'm very proud of our team, not only that evening, but every evening that they serve our community.
What's the lessons learned from that?
You know, it was a large-scale event. Every hospital did a great job that evening. All the trauma centers, all the emergency departments really did a phenomenal job. You know, I think what took me back is just the community support, how immediately our community came together and supported each other, supported the hospitals, supported the first responders, supported the families and the victims. I think that's what took me by surprise, and how quickly it happened and how sustained it was. Just the overwhelming support of people showing up, wanting to contribute, to donate, help in any way that they can.
Yeah, I was down in Las Vegas a couple of weeks after that for a taping session, and I was amazed at the response because that really hadn't come out in the press. Even though there was, the high-level government support for the community, but it was actually the people-to-people situation, the donations of blood, et cetera, the long lines to do such, that was really amazing.
It was absolutely powerful, and I will never forget it. I was just extremely proud of our community. And
it proves to a lot of people around the world that Las Vegas is an actual community. It's not just the Las Vegas Strip, it's a lot more than that.
Absolutely.
Wanted to get to a couple of issues here. There was a story in the Las Vegas Review-Journal recently about this emergency room, Elite, that is opened up on the Las Vegas Strip. And my understanding is that you have some concerns about that. Lay out exactly, what kind of hospital, I believe it's called a micro-hospital, and explain what it is and what your concerns are.
Yes, and I appreciate the question. We are concerned about this particular location. Let me describe a micro-hospital first. It's a trend in healthcare. They are smaller scale hospitals. Typically, they're supported by a larger institution or an integrated system. They're showing up in areas where they're underserved with access to healthcare. Many of the hospitals that are serving our community in the state get a license through the state. They also go through an accreditation process, such as the Joint Commission. They also participate in the Centers for Medicare and Medicaid Services, which then applies to the Emergency Medicine Treatment Labor Act. So basically it says that all hospitals will treat a patient and stabilize them regardless of their ability to pay. And then a lot of these hospitals will also go out and contract with your local insurance plan. There are some hospitals, such as Elite, which is considered a micro-hospital. They're licensed by the state, but they operate very differently. They're independent. They don't have the strength of a healthcare system backing them up. They do obtain a license in the state, but they don't go through a Joint Commission or an accreditation process. They also don't participate in Medicare and Medicaid, which is about 70% of our patient population in the state of Nevada fall into those two categories, which also means that they don't have to abide by Emergency Medicine Treatment Labor Act standards, which essentially says that they can turn you away based off your ability to pay. And they purposely don't go out and contract with your local insurance company. So basically it's more of a cash and carry business, private pay, but for the unwitting or the person that's not knowledgeable on these type of hospitals, they could have a huge surprise.
In terms of their bill at the end of this thing?
Also about the quality of care, because if you're an accredited or participate in Medicare or Medicaid, you're afforded certain rights. Your access to healthcare, diagnostic services, safe transfers, appropriate billing, a host of quality things that your typical hospital abides by, but these particular micro-hospitals that are working in the shadows of other hospitals don't abide by those rules. And that's what we're very concerned about, is patient safety and being informed on what you're choosing as far as seeking out your healthcare needs.
Are there any things that you can do as far as the legislature goes to enable more governance of these kind of hospitals, or at least in terms of transparency, because you've got millions of tourists coming every year to the Las Vegas Strip. They see on the Strip these massive Walgreens and CVS's, so medical care is all along that Las Vegas Strip. They see an emergency room, they think, oh, this is the place to go, but there's no warning that they could be hit with a huge bill at the end of this thing.
Correct. Under the current standards, there is not any warnings or regulation around these type of hospitals, and they're strategically placed to prey on our tourists and the unwitting. So I know Clark County is looking at how do we manage this and protect the current patients, the residents of Las Vegas, but also the tourists that are visiting our community, because the last thing that we want to do is have somebody leave our community and unfortunately be financially surprised because they've been billed full charges or out of network.
Another area that is of concern, I know, to you, which is the applications to be trauma centers for many of the hospitals. I believe there are 7 applications currently for trauma centers. And this appears to be a result of the Affordable Care Act. And explain what the concerns are, especially in the financial areas.
Sure. Let me describe the trauma system in Southern Nevada currently. There are 3 trauma centers, UMC being the level 1, which is the highest level of care. We have a level 2 trauma center, which is Sunrise on the east side of town. And then also Dignity Sienna campus is a level 3 trauma center. Currently, the trauma system is working extremely well, serving our community, meeting all the patient response times, transport times, and patient outcomes. In fact, there is current capacity in the existing trauma centers that we have today. The concern is, as you mentioned, as there potentially may be a doubling or potentially even being a tripling of the amount of trauma centers in our community. And we believe that creates waste, duplicates services, increases cost, but also dilutes the quality of care at the current trauma centers.
Also, the cost, because there's a fee.
The trauma activation fee.
Yeah, thank you.
Yeah,
trauma
yes,
activation fee. In some cases, this can be up to $60,000.
Correct.
And that's just added into the cost of your medical services.
And you know, we have great emergency departments in Las Vegas. We've got well over 15 hospitals serving our community, and you're right, this is an additional fee that could be tacked on and will be tacked on to patients that are visiting trauma centers or end up in a trauma center, upwards to $20,000, $40,000 in addition to their current hospital charges and their physician charges. So it is a lucrative charge, and it is concerning that there are some hospitals that are out there pursuing it for that reason.
And how do the insurance companies feel about this? Are they covering this amount?
Well, the insurance companies are supportive of the existing trauma system that we have today. Now, there certainly has been population growth throughout Las Vegas over the last several years, and our regional trauma advisory board that advises the Southern Nevada Health District has set up the criteria to be able to grow in a prudent way the trauma center. Again, we don't feel like creating an oversupply of level 3 trauma centers is the right thing to do, because although more sounds better, you do create quality and have better outcomes via volume and doing repetitive procedures and taking care of trauma patients. So it is a concern. The Southern Nevada Health District will be listening to those applications that you mentioned later in the year, but they'll be looking at population growth, duration of time and distance for traveling, other things about quality indication scores. But again, we don't feel like there's a need to dismantle the current trauma system and create an oversupply of level 3 trauma centers.
And also, level 3 trauma centers can't handle everything the way, for example, a level 1 system can. So there may be transportation issues from those other facilities to UMC because you have that base.
And that's correct, Sam. You know, I think there's a lot of confusion on level 3 and what an emergency department. The New England Journal of Medicine actually says that the quality of care is no different in an emergency department in a level 3. Most patients, in fact all patients at level 3 have vital signs that are stable. Patients are stable and alert and transported within a very short period of time. In fact, our current transportation time in the entire valley, regardless of where the injury happens, is just over 16 minutes in Las Vegas. So creating overlap and diluting the current trauma system is very concerning. And back to your original point, is it could be very lucrative for some of those that are choosing to apply this time around.
All right, let's take a break. More with the head of University Medical Center when we come back.
Tamarack Junction is South Reno's hotspot with over 450 of the latest slots and video games. Sully's Sports Bar, the Dining Car Restaurant, William Hill Sportsbook, and the Tamarack Steakhouse and Lounge. We're just north of the Summit Mall in South Virginia.
Yeah. How do you shed some light on a better economy? Start with growth inspired by Valley Electric Association. We're a member-owned power company that puts Nevada first, and we're doing big things, like providing prosperity by securing renewable energy projects. For Nevada, that means more jobs and more opportunities, all for a strong statewide economy. In other words, together, we're doing powerful things. Visit us at vea.coop to learn more.
Hi, I'm Eric Robnett, owner of Home Energy Experts. Has this ever happened to you?
Honey, did you remember to turn down the thermostat?
Forgetting to set the temperature? Not fun. We can help. Our new smart thermostat keeps the temperature set for your comfort all by itself.
I'm feeling hot now.
To increase your comfort, go to homeenergyexperts.com for details. That's homeenergyexperts.com.
The signs and symptoms of cataracts can start out small with subtle changes in your vision. So don't wait. Be proactive and take your vision into your own hands. If you're experiencing the onset of cataracts or just have questions, contact your eye care professional or call Eye Care Associates of Nevada today. Dr. Hiss has years of experience specializing in the surgical correction of eye disorders and has completed over 84,000 vision correcting procedures. At Eye Care Associates of Nevada, we'll change the way you look at the world.
The Tamarack Junction Steakhouse is known for signature steaks, handcrafted cocktails, and world-class wines. Join us Thursdays and Friday nights from 4:30 to 6:30 in the Steakhouse Lounge for live music, gourmet plates, and well-priced wines, just north of the Summit Mall on South Virginia.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, coming to you from Carson City, we're talking with Mason Van Houweling. He's the CEO of University Medical Center. So let's talk about the reason that you're here to address the legislature. And this is Clark County's request to purchase services through the GPO. Explain what the GPO is and how that benefits.
Sure. GPO stands for Group Purchasing Organization. It's basically a consortium of hospitals and surgery centers and doctors' offices. In fact, 1,500 hospitals, 31,000 different healthcare organizations that participate in a GPO that UMC participates in. And since 1999, we've been afforded the ability to buy some of our equipment and supplies at a discounted price.
Sort of the Costco of the medical world.
That's a great analogy, Sam. And through those years, over the last 20 years or so, the menu's kind of expanded, and we've had the authority through NRS to be able to purchase, and it saves the taxpayers a lot of money, getting that buying power versus UMC and going out and negotiating contracts on our own. Well, services has expanded over the years with our GPOs. So such things as blood services that are vital to UMC, linen services. We're a 541-bed hospital. We've got a lot of linen that we use at the hospital. So we want to be able to add the word services to our bill, which is SB 77. I'll be testifying on that later today, but allow us to be able to access that pricing and be able to save the taxpayers money. We're looking at our current contracts that we have. If we're able to do that and be able to access our GPO and purchase the same contracts that we have today, could save upwards to $1 million a year for the hospital. So I think that's a win for UMC and the taxpayers.
Speaking of financial situation, when you inherited UMC, UMC was probably most famous for being in debt every year, the county having to rescue the hospital because it is the county hospital. But that whole financial situation has turned around under your leadership. Tell us what you did to turn red into black.
Sure, I appreciate that question, and very proud of our success in many ways, quality and outcomes, but also financially. Since 2014, we've been able to turn the hospital around. For the first time in its history, we've been able to actually make a profit and reinvest those profits back into the facility, and more importantly, minimize the subsidy that historically has been afforded UMC, upwards to $100 million annually. We have not had to take that subsidy to fund the operations of the hospital. So for going on 4+ years, the hospital has been in the black, and the good thing is we've been able to reinvest back in our community. We've been able to grow our quick cares and our ambulatory division out in the community, be able to provide care closer to home, reinvest in technology and infrastructure in the hospital. So it's exciting times at UMC, and foresee many, many years of success.
All right, let's take another break, and we'll be right back in Carson City after this.
Dimitri Prine here for Design Outdoor. At Design Outdoor, we specialize in all hardscapes, pavers, and walls you'll need for everything, from wonderful small yards to full-blown outdoor living. And we only refer the best contractors to make your vision a reality. Our store and backyard are located at 11600 South Virginia, just north of DeMonte Ranch Parkway. Visit designoutdoor.com or call us at 851-9499.
I'm men's rights attorney Marilyn York, and because I represent men in all family law matters, women often call me gender traitor, woman hater, and even disgusting. So why represent men and target myself with these offensive monikers? It's simple. Children with fathers in their lives are 6 times less likely to drop out of school, 15 times less likely to go to prison, and 5 times less likely to commit suicide. So ladies, you can hate me, but please love your children more than you hate their fathers.
Hi, I'm Dave Newman. Remember me? I used to be the house detective, and now I'm a realtor, full-time at RE/MAX Realty Affiliates. A lot of people ask me, how's the market? You know what? It's fantastic. If you're even kicking around the idea of buying or selling, give me a call. Let's talk about it. Call me at RE/MAX Realty Affiliates and just ask for the guy who used to be the house detective, Dave Newman.
Everyone is talking about opioids, but they're not the only drugs that can be harmful if taken in large quantities or not as prescribed. You also need to be aware of side effects from anxiety drugs, muscle relaxants, sleep aids, and stimulants. Mixing prescription drugs with other drugs or alcohol can be dangerous. If you take an Ambien with a glass of wine, it may be enough to stop you from breathing. Prescribed drugs can be just as dangerous as illegal drugs. Take medications only as directed.
The signs and symptoms of cataracts can start out small with subtle changes in your vision. So don't wait. Be proactive and take your vision into your own hands. If you're experiencing the onset of cataracts or just have questions, contact your eye care professional or call Eye Care Associates of Nevada today. Dr. Hiss has years of experience specializing in the surgical correction of eye disorders and has completed over 84,000 vision correcting procedures. At Eye Care Associates of Nevada, we'll change the way you look at the world.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, coming to you from Carson City, we continue our conversation with the CEO of University Medical Center, Mason Van Houweling. I wanted to ask you, right now we have, I think, 500 candidates running on the Democratic side, or at least it seems like that, for president. And the cry is Medicare for all. And how does that strike you in terms of the reality of that?
Sure, I think the conversations around Medicare for all or Medicaid for all, I really think we need to focus on how do we stabilize the private markets? How do we get employers and private insurance more into the game versus Medicare and Medicaid? For most providers, Medicaid only covers about 1/3 of our cost, whether you're a physician or a small practice or a nursing home or a large hospital like UMC. So it's very difficult for us to operate under Medicaid reimbursement. It's a challenge. With Medicare, it typically covers hospital costs. So we believe that if we can stabilize the markets in the private insurance, give opportunities to reduce premiums on employers, offer more robust insurance plans for patients and employees, that's the right direction versus more of care provided by and subsidized by the government.
Doesn't it seems to me at least, to be an impossible situation when people have been paying 30, 40 years into Medicare and then receive the benefits upon retirement, that to suddenly open it up to the entire population, the cost would be incredible.
It's financially not stable. I mean, you pencil it out. It's the number of workers to beneficiaries continues to drop year over year, and it certainly would go bust. And I think the right answer is, how do we reduce costs to employers on private insurance? How do we reduce drug costs? Obviously, that's a big issue that's being addressed in DC now, because that typically has double-digit inflation every year for hospitals, for patients. And so how do you bring down some of those costs, make it more affordable, so employers are providing that for their employees as a benefit?
But when you see the strength of the pharma lobby, what do you think the chances are of being able to do that?
It's formidable. It is definitely formidable. They have a strong lobbying position. And I understand some of their sides that, you don't want to limit innovation and technology, but there's got to be a balance. And to be able to have it sustainable for everyone, for employers, for providers, insurance companies, and for hospitals.
One of the biggest questions about Medicaid in the Silver State is that A, we don't have enough doctors to begin with, but B, a lot of doctors' practices are not accepting Medicaid. So how are these people going to get treatment even if they have the coverage?
That's a big concern, and that's called network adequacy. And we experience at UMC that when somebody does come in and we're able to get them assistance or they're a Medicaid beneficiary, there's not the providers out there, whether it's nursing homes or skilled acute care facilities, but mainly on the physician side is that a lot of physicians aren't accepting Medicaid as a form of reimbursement and just not providing, which unfortunately then patients that don't have a primary care physician or nowhere to go end up utilizing the emergency department, which is the most expensive place that you can actually deliver care and the most inappropriate.
The good news is that you've got the partnership with UNLV, so at least you're in the process of helping train doctors for the future. We have about a minute left here.
Yeah, no, it's been great. UNLV's in recruiting their third year of medical students. UMC has been in the academic teaching business for a long time, and our partnership with UNLV is very exciting. We have 215 residents and fellows in 17 different programs, so we're very proud of teaching the next generation of physicians here in Nevada.
And that's where we have to leave it. Thank you so much for doing this.
Thank you, Sam.
And please come back again and see us, all right?
Anytime.
Thank you.
Thank
We'll
you.
be right back.
A bird's eye captures its surroundings at different heights. At Brian Culpa Photography, we can make your imagination soar over buildings, parks, cityscapes, and beyond. Brian's images tell the story and get the job done. If you need a new perspective to tell your story, contact Brian today. Brian Culpa Photography. Experience the bird's eye view at brianculpaphotography.com.
Hi, my name's Marilyn Miner, and I'm sure you'd agree that Nevada's a very special place to live. I was born here, and my husband and I have raised our family here. I feel it's a privilege to live and work in the Truckee Meadows. I especially enjoy helping my clients reach their real estate goals. Sometimes the smallest details provide the greatest satisfaction. I'd be complimented to talk to you about your next move.
Call Marilyn Miner at Dixon Realty, 742-1280, or log on to marilynminer.com.
St. Ives Florist, for every holiday and every special occasion. For romance. Custom home design. We have the largest selection of fresh flowers in northern Nevada. And we also offer a large selection of unique gift items. Come see me, Lorianne, at St. Ives Florist, 700 South Wells Avenue, or call me at 333-9190.
Pro Group Management is the place where companies can find workers' comp solutions that are designed to meet their specific business requirements. As regulations evolve, Pro Group takes a proactive approach to clear the path to make sure your business stays ahead of the curve. Knowing your workers' comp program is optimized, you can focus on other important matters related to your growing business. Pro Group Management, workers' comp that works for you.
Now you can watch Nevada Newsmakers on YouTube. We have our own channel. Just search Nevada Newsmakers. We'll see you on the next broadcast.